Thanks for joining us today. We welcome you all to the New South Wales Health Research Handbook webinar. I'll start by acknowledging the traditional custodians of the land we are on today. James and myself are on Dharug land, and I would also like to pay respects to elders past, present, and emerging, and extend that respect to all Aboriginal people joining us here today. Some housekeeping. This webinar is being recorded. A recording, along with the slide deck, will be sent to all participants after the session. The webinar will last for 30 minutes. To ensure a smooth and uninterrupted session, we will address all your queries in a 30 minutes Q&A session following the webinar. If you have any questions during the presentation, kindly type them in the Q&A window at any time. As always, feel free to email our team at any time. Hyperlinks throughout the document are highlighted in blue for easy reference and navigation. You could use this slide deck as a reference point and adapt it locally. Also, please scan the QR code to access the handbook and related documents. In this session, you will receive an overview of the New South Wales Research Handbook, its implementation strategy, and the feedback form for the handbook, and a Q&A session. As we all know, New South Wales Health is dedicated to top quality research. To support this, OHMR have developed and released the New South Wales Health Research Handbook. This handbook is designed to be a living document, allowing LHDs and specialty health networks to customize it for their day-to-day operation without altering the core content. And if you read the handbook, you notice yellow highlighted sections throughout the handbook. They are intended for local adaptation. Again, please scan the QR code you see on the screen to access the handbook and associated documents. The purpose of the handbook is to help researchers and research development officers to ensure that research at New South Wales Health is safe, valid, and of the highest quality. This document applies to all New South Wales Health employees and any external partners involved in human research. Essentially, if you are engaged in research within New South Wales Health, these guidelines are for you. As a starting point, researchers or anyone involved in human research should begin by reading or reviewing this handbook, relevant New South Wales health policies, and SOPs. It's also important to stay updated on relevant laws, guidelines, and regulations affecting your research. The handbook aims to embed research enabling culture in New South Wales Health Organisation. Therefore, use this handbook extensively and distribute it widely. As you can see in the figure, each one of us play a critical role in embedding a research enabling culture. The New South Wales Handbook also provides insights into research governance framework. If you shift your gaze onto the right side of the slide, you see an example of research governance framework that outlines the structure, roles, and responsibilities for managing research in an organization. An effective research governance framework is composed of research policies, procedures, training, and includes a quality assurance program. Well, in the researcher sections of the handbook, there is an emphasis on GCP as the gold standard for ensuring ethics and safety in human research. You research operation managers can encourage researchers to access accredited GCP training via the Transcelerate Biopharma Inc. website by scanning the QR code that you see on the screen. The credentialing processes ensure researchers are qualified, while PI is responsible for the overall conduct of the study. And also there is a section on student access to LHD or SHN-owned medical records for research purposes. So you people could use this critical information on researchers to uphold high standards in clinical research and manage their responsibilities effectively. And the handbook's new research proposal section, it offers research governance. So you could use this to guide researchers to align their projects with New South Wales health policies, ensuring efficient and compliant research practices, such as early consultation process with department heads, senior managers, and New South Wales Health Pathology for proper coordination. Discuss risk assessment and mitigation proactively to avoid delays. Encourage researchers to use the local research development office for efficient protocol design and approvals. So overall, this process or this approach ensures research projects are consistent, compliant, and well supported. The protocol design section emphasizes the importance of a well-crafted protocol to minimize amendments and deviations. Key elements highlighted include team composition, like how can one assemble a diverse team of health professionals, statisticians, regulatory experts, and community representatives for comprehensive insight. And there's a section on consumer and community engagement that aligns with NHMRC principles for engaging consumers and the community to enhance research quality and impact. Indigenous health research, you could utilize a panel of Aboriginal and Torres Strait Islander representatives for culturally relevant and ethical review. And there are some protocol templates that adhere to standards like SPIRIT for clinical and non-interventional research. And there are some additional resources where you could refer to ACTA Toolkit and COMET for practical guidance on consumer engagement and outcome measures. Following these guidelines will help in developing a robust protocol that minimizes the need for change, ensures ethical and culturally sensitive practices, and enhances the overall quality of research. The handbook outlines key aspects of ethical review. The guiding principles adhere to National Statement on Ethical Conduct in Human Research 2023, the AIA TSIS Code for Ethics, and relevant legislation, including the Privacy Act and Therapeutics Goods Act, to ensure participant rights and safety. And you people could assist your research staff to conduct thorough risk assessment, evaluate all potential risks, including physical, emotional, social, and legal aspects, to ensure a safe and compliant research environment. Research can be categorized into high and low risk using an HMRC risk continuum, which supports a nuanced assessment of research activities. Review pathways, lower risk research suitable for studies that present minimal risk may be reviewed by a designated committee or subcommittee within the institute, again adhering to New South Wales health guidelines. On the other hand, higher risk research requires full HREC review and includes studies needing TGA approval. There could be some exemptions, such as certain low-risk studies, those including anonymized data or quality improvement projects. They may qualify for exemption. Biobanks, they need HREC approval, and they are supported by New South Wales Health statewide biobank partnerships. Also, some research projects have specialized HREC review requirements, such as Justice Health, Aboriginal Health and Medical Research Council, New South Wales Population and Health Service Research Ethics Committee, early phase clinical trials, and trials with persons unable to provide consent. Use the online Regis portal for ethics and governance submission to streamline the approval process. So overall, this section, ethical review section, covers the key elements of all the ethical reviews comprehensively. Use this material to ensure that research complies with ethical standards and to facilitate efficient approvals. The next section is guidelines for site authorization in New South Wales health organizations and its purpose. There are different pathways to site authorizations like SSA and access request. On this note, please download the New South Wales Health SSA Roles and Responsibility document from our website using the QR code you see on the screen. This document outlines the roles and responsibilities of key staff when completing, reviewing, and authorizing a SSA in line with New South Wales Health Policy Directive 201056, that is research authorization to commence human research in New South Wales public organizations. Process and requirements, applications must be submitted via REGIS and SSA form to RGOs. And there is role of RGOs who provide critical support throughout the approval process. And there are additional resources and support, like the use of New South Wales Health Operations Manual, OHMR resource, and also we have a decision tree for SSA versus access request. Again, please scan the QR code that you see on the screen. And this resource help researchers determine whether a SSA or access request is more appropriate for their research project. By following the structured process for site authorization, leveraging REGIS for streamlined submission, collaborating with RGOs and department heads, one can ensure a successful approval. The handbook covers critical aspects of managing conflicts of interest and data management. Researchers must disclose and manage all actual, potential, or perceived conflicts in line with NHMRC guidelines and New South Wales Health Policy. And your research operation manager who oversee the proper data management and retention of data throughout the project, you could use this section to guide your researchers to develop data management plans as per New South Wales Health Policies and NHMRC guidelines. How to store and analyze data using approved New South Wales Health platforms and in line with the New South Wales Health Policy on Electronic Information Security. Utilize REDCap for secure data management to ensure data integrity and confidentiality. And there's a section on clinical trials management system, how one could use this for effective participant management, budget oversight, and compliance with WHO standards. Access these CTMS resources via CTMS SharePoint site. Confidentiality and data sharing section discusses how to protect participant privacy in line with New South Wales Health and national guidelines. Use secure methods like Kiteworks for data sharing. Retention and biospecimen management. One has to adhere to legal, regulatory, and funding requirements for data retention and access biospecimens through New South Wales Health Pathology Standardized Approach. These materials guide to ensure compliance and implement best practices for handling conflicts and data management in research activities. And there is this section on IP management and regulatory requirements. And as a research operation manager, you ensure adherence to the NHMRC national principles and New South Wales health policies for managing IP in publicly funded research. This includes proper documentation, protection strategies, and compliance with IP regulations. Ensure compliance with TG requirements, and this involves obtaining CTN or CTA as required. Authority to prescribe drugs of addiction, where one must obtain New South Wales Health Authority for prescribing Schedule 8, 9, or 1 drugs. Adhere to Gene Technology Act 2000 and OGTR regulations. A GMO license is a must for gene modification activities. And if research involves human embryos, please ensure that NHMRC licenses and HREC approval are obtained before commencing any research activities involving human embryos. These are regulated by the RIHE Act and New South Wales legislations. For research involving ionizing radiations, follow the ARPANSA code RPS 8, and compliance with radiation exposure standards is essential. NCAT approval is required for participants who are unable to provide informed consent. This must be obtained before New South Wales Health Governance Authorization. Use these resources in the handbook to ensure compliance with IP policies and regulatory frameworks, and also to secure necessary approval for all your research activities. Now let's dive into the essentials of clinical trials registration and publication. The clinical trial registration section speaks about what's required before you recruit your first participant to any clinical trials. Make sure this is registered on WHO ICTRP compliant register, and white matters, who is in charge, and so on and so forth. There's a section on publication requirements where we all must adhere to ICMJE guidelines. And also keep in mind, some non-clinical studies may need to be registered, especially if dictated by funding conditions. These crucial points on clinical trial registration and publication can be leveraged to ensure all trials are properly registered and meet publication requirements. Now let's focus on the National Clinical Trials Governance Framework that aims to provide a structured approach to the governance of clinical trials. There's a section on implementation. Research Development Office could be a part of this dedicated working group, and you can see the contact detail or the email address on the screen. And as I mentioned earlier, we'll be circulating this slide deck. For more details on this framework, please use the links in the resource section. By following these guidelines and utilizing these available resources, you can ensure that all clinical trials are conducted in alignment with NCTGF standards and compliance requirements. The research management section of the handbook outlines essential elements for managing research, budgets, clinical trials, and funding sources. It emphasizes the importance of adhering to New South Wales health fee policies and ensuring compliance with financial and resource management standards. Key responsibilities include developing and monitoring research budgets, managing external service provider agreements, and fulfilling specific roles for principal investigators and research development officers. Overall, this section assists you people to ensure compliance, support project success, and optimize resource use throughout the research lifecycle. Research agreement section speaks about different types of formal research agreement that must be established and approved by the chief executive or their delegate before starting the project. This applies when collaborating with New South Wales health organizations and external entities such as sponsors, ROs, or research institutes. Agreement requirements and types of agreements, it's context dependent, such as it could be CTRA or CIRA, or there could be custom agreements. NACTA panel application details, or you can see them on NACTA website, and it's a link that you can see on the screen. There is a strong encouragement to use electronic signatures in executing research agreements, and research offices across New South Wales can use this material to ensure all research agreements are appropriately managed and compliant with New South Wales health standards. The handbook outlines key aspects of insurance and indemnity essential for conducting research in New South Wales health. There is an overview on insurance and indemnity, its importance and requirements, and commercially sponsored trials section, coverage of insurance and collaborative research groups, their liability and insurance cover, investigator-initiated clinical trials, and there's a section on treasury managed funds and its purpose. And also there are resources that guide in achieving compliances. So this section comes in handy to you people to ensure proper insurance coverage and indemnity arrangements are in place for all your research projects, ensuring financial and legal protection throughout the research process. The next section is on safety monitoring and reporting responsibilities. What are the mechanisms of safety monitoring, and what are all the monitoring methods and the frequencies of monitoring that could depend on the risk level associated with research projects? Reporting safety events should align with New South Wales Health and NHMRC guidelines, including adverse events in clinical trials. Data safety monitoring guidance is according to NHMRC guidelines on DSMBs, which review trial data periodically. Reporting serious breaches, they again align with NHMRC reporting guidance and New South Wales health requirements. By adhering to these guidelines, you can manage safety risks, report events accurately, and comply with all relevant safety and regulatory standards. And the next section, it outlines crucial aspects of managing research misconduct and compliance. What does research misconduct mean? Its definition, scope, exclusions, and staff responsibilities in reporting. All research staff must promptly report any suspected breaches of the code or misconduct, whether arising from their own actions or those of others. Management of complaints, it should be as per the New South Wales Health SOP, which again aligns with NHMRC guidelines for handling and investigating such issues. Use these guidelines to ensure that all staff members are aware of their responsibilities for reporting research misconduct and understand the procedures for managing and investigating compliance. This promotes a culture of integrity and compliance in research activities. The last section in the handbook is on authorship, research output, and communications. This is how to ensure the results from research are shared effectively with both the research community and the public while respecting any publication restrictions. and what are the responsibilities, authorships and attributions, publication principles, ethical review, institutional requirements. New South Wales Health managing authorship of research output SOPs and related NHMRC guidelines provide further details. Use these guidelines to ensure effective dissemination of research results, proper authorship and attribution, and adherence to publication principles and ethical reviews. So moving on to our implementation strategies. We have kicked off the implementation strategy by officially releasing this handbook on our webpage. And we had emailed you people about the same 2 or 3 weeks ago, and also to the research directors about this release. And today's webinar to you people is our first webinar about the handbook release and the implementation strategy. So please disseminate this information amongst your network. So our strategies moving forward, we will regularly update all our stakeholders on the release of the handbook and inform you of any changes or additions. Updates will be communicated through various platforms such as emails, newsletters, LinkedIn, directors meeting, and others to ensure everyone remains informed. We will educate all our stakeholders to facilitate a smooth introduction to the handbook. We will organize formal webinars like today for all our research staff. We will also develop fact sheets and FAQs to assist using the handbook and feedback form. We are collecting feedback over the next 6 to 12 months period to enhance the handbook and ensure it supports a research enabling culture in New South Wales Health. We encourage you to share this handbook widely and utilize it extensively. To ensure your insights are considered for the initial revision, that is for our Jan 2025 release, please submit your feedback by December 20, 2024. Again, feedbacks received after this date will be reviewed for potential inclusion in a subsequent version of the handbook. Moving on to our feedback form, please scan the QR code you see on the screen to access the feedback form. And this form has been broken into 2 sections. The first section is the contact details. It's important that we know who has provided the comments in case we need further clarification. And the second section is on document review, where we have the sections included to match the main headings of the document. Whenever there is a subheading, please add this into the beginning of your comment. So this will allow us to keep track of the comments and make amendments to that respective section. If you feel any sections or topic that might be relevant to research staff or missing from this handbook, please do let us know.
New South Wales Health Research Administrator Awards 2024. So the voting for the Research Administrator Awards closes on Friday, 30th of August. We are looking forward to doing a big awards afternoon at the roundtable on 27th of September. And we're really excited about this. We're promoting it widely. And so we really like particularly those awards where research officers are involved to please get feedback in, and particularly around projects where you've seen where you can brag. That's what we're looking for. And so the second thing is going to send around during the week a consultation for an update to our guideline on standardized patient information sheets. There's been developments at a national level with the CTIQ informed patient information and consent form template. NMA, the working group, is having meetings in order to look to adopt that. We think it's an excellent form. We know that at least one ethics committee in New South Wales is piloting it and has had good feedback around it. But we are looking to send it out to ethics committees within New South Wales and getting some feedback on that from them, and also just doing a couple of webinars around that so that we can have a position that we can take to the NMA working group, and hopefully moving past the NH and MRC information sheets and adopting a new consumer-facing focused information sheet. So those are just announcements for everyone to be aware of. Obviously, we're here at the end of email contacts for any questions. But look, thank you very much. Firstly, thank you very much to Ambika for stepping in and taking it on for the implementation for the handbook. Appreciate your doing that. And thank you very much, everyone, for being on today. I really appreciate your time, and thank you.